Insects, bites, and stings, a safety meeting video brought to you by weeklysafety.com. Let's get started. Insects and spiders may seem like minor concerns, but their bites and stings can cause painful injuries, trigger allergic reactions, lead to missed work time, and distract workers from staying focused on the job. Outdoor work environments can expose you to bees, wasps, fire ants, spiders, and ticks. Understanding these hazards, knowing how to prevent contact, and responding correctly if you are bitten or stung are critical to staying safe. Bites and stings can cause painful reactions, infections, or severe allergic responses. Some insects inject venom, while others, like ticks, can spread diseases. Quick recognition and proper first aid can prevent a small incident from becoming a medical emergency. Bees and wasps. Bees are generally not aggressive unless provoked. When a bee stings, the stinger and venom sac remain in the skin and continue releasing venom. It is important to remove the stinger as soon as possible by scraping it with a fingernail, the edge of a card, or another flat surface. Avoid squeezing the venom sac, which can inject more venom into the wound. Wasps are different. They can sting multiple times without losing their stinger. Their venom may cause redness, swelling, and pain, and in some cases, infection. For most people, bee and wasp stings are painful, but not life-threatening. However, if you experience severe chest pain, difficulty breathing, dizziness, confusion, or swelling in the face or throat, get medical help immediately. Anyone who knows they are allergic to insect stings should inform their team before work begins, carry an EpiPen, and consider wearing a medical alert bracelet or necklace. Fire ants. Fire ants are highly aggressive and will attack anything that disturbs their mound. They bite to hold on and then sting repeatedly, injecting venom that causes a burning sensation. Within a day or two, the sting sites often develop white, fluid-filled pustules. If you are attacked by fire ants, leave the area immediately and brush them off with a gloved hand or a cloth. Avoid standing on or near fire ant mounds and always inspect your work area for nests before starting. As with bee and wasp stings, fire ant venom can cause severe allergic reactions in some people. If symptoms like trouble breathing, dizziness, or swelling of the face or throat occur, you could be having an allergic reaction and should seek emergency medical attention right away. Spiders. Spiders often hide in dark, undisturbed areas, such as woodpiles, debris, or underneath leaves. Two dangerous species to watch for are the black widow and the brown recluse. Black widow spiders can be identified by a red hourglass marking on the underside of their body. Their bite usually shows two small puncture marks. The venom can cause intense pain at the bite site that spreads to the chest, abdomen, or throughout the body. Brown recluse spiders, also called violin spiders or fiddlebacks, have a dark violin-shaped marking on their upper body. Their venom destroys tissue at the bite site, which can lead to severe infection if not treated promptly. If bitten by a black widow or brown recluse spider, clean the bite with soap and water, apply ice to slow venom absorption and reduce discomfort, and then seek medical attention right away. Ticks. Ticks often live in wooded areas, tall grass, and brush. They can carry bacteria, parasites, or viruses that cause diseases such as Lyme disease. Ticks are most active in spring, summer, and fall, but can remain a hazard year-round in warmer climates. After working outdoors, always check your clothing and skin for ticks. If you find one attached, use fine-tipped tweezers to grasp it close to the skin and pull steadily until it releases. Clean the bite area thoroughly with soap and water. Never burn ticks or use chemicals to remove them, as these methods can cause more harm. Prevention. Avoiding bites and stings starts with being aware of your surroundings. Inspect your work area for signs of insect or spider activity, such as nests, mounds, or webs, and be aware of areas where ticks are likely to be present before starting work. Wearing the right clothing can reduce your exposure. Light-colored, smooth-finished clothing that covers the arms and legs makes it easier to spot insects and helps protect your skin. Before putting on gloves, shoes, or clothing that has been left on the ground or stored in an undisturbed area, always shake them out. This simple step helps prevent surprise encounters with spiders or insects that may have crawled inside. Keep your work areas clean because discarded food and trash attract insects. In tick-prone areas, avoid tall grass and dense vegetation when possible. First aid. For most bites or stings, wash the area with soap and water and apply ice to reduce pain and swelling. Watch for signs of infection, such as redness, warmth, or increasing pain. Seek emergency medical care immediately if you experience serious symptoms like chest pain, difficulty breathing, severe swelling, nausea, sweating, dizziness, or slurred speech. For anyone with known severe allergies, always have an emergency plan and ensure your coworkers know how to assist if a reaction occurs. Stay aware. Insects and spiders may seem like small hazards, but for some people, or in some situations, they can lead to serious consequences. By staying alert, wearing protective clothing, keeping work areas clean, and knowing how to respond, you can prevent bites and stings from becoming dangerous. Thank you for attending this safety meeting. Stay aware, stay protected, and stay safe.